We are grateful for the opportunity to present our poster to you today, focused on findings obtained through our ITP Natural History Study Registry on whether pediatric ITP patients and young adults under the age of 21 years have unique experiences with COVID-19 disease and vaccinations. Our study is a small preliminary study and one of the first to showcase patient-reported outcomes in this age cohort of ITP patients. Due to the small sample size we recruited, our study represents only preliminary findings from our registry. The ITP Natural History Study Registry is composed of 7 surveys designed to collect information on patient demographics, medical history, treatment history, quality of life in both adult and pediatric ITP patients, as well as with their experiences with COVID-19 infection and vaccinations. Our COVID-19 and ITP survey launched in February of 2021. The registry is accessible to all ITP patients through our website. As of June 23, 2022, 21 parents of children with ITP under the age of 18 years and 9 young adults between the ages of 18 and 21 years with pre-existing ITP had completed the survey. In terms of viral disease, 11 participants were diagnosed with SARS-CoV-2, and of these, none of them reported a platelet count decrease. There were no bleeding events self-reported during or after infection. In terms of vaccinations, 24 participants reported receiving at least one vaccine dose, and 20, which represented just over 2/3, were fully vaccinated. Only 22 of the 24 reported about their platelet counts. Return to baseline occurred within a month within the majority of participants. 6 of the 30, which represented 20%, reported a platelet count decrease in past following a non-COVID related vaccine, and of these, 5 self-reported that they were fully vaccinated and did not have a platelet count drop following either standard dose. There were 3 de novo cases detected following dose 1, but these were not included in the study. Of the 22 participants who A. had dose 1 and B. answered questions regarding their platelet count response, 23% reported they experienced a platelet count decrease and 67% reported that they returned to baseline within a month. For dose 2, of the 20 participants who reported they had dose 2 and answered the questions regarding their platelet count response, 35% reported a platelet count decrease, and again, 67% reported that they returned to their normal baseline within a month. So there were more decreases seen in dose 2. The decreases were more common in dose 2 if a platelet count decrease was seen following dose 1, and this difference was significant. It's important to remember that these represent only preliminary results in 30 children and young adults, although they should serve to reassure parents further that the risk for a platelet count decrease and worsening ITP appears to be quite low. Platelet count decreases were transient for the most part. Using the platelet count response to dose 1 wasn't a strong predictor for predicting dose 2. However, we did see more platelet count decreases following dose 2 if they had a decrease following dose 1, and this was significant. These findings should reduce vaccine hesitancy among ITP caregivers and young adults. Thank you for listening to our presentation.